1. A new manager does not seem to trust that assignment will be completed as delegated, without significant supervision and direction. This style of management is called A. Laissez-faire, B. Autocratic, C. Democratic, D. Diplomatic. 2. Accessing a 911 system in an emergency is an example of A. First aid relief, B. Primary prevention, C. Secondary prevention, D. Tertiary prevention. 3. The teaching plan for a pregnant woman who was obsessed prior to pregnancy should include which of the following instructions? A. You should gain 28-40 pounds, 12 to 18 kilograms. B. You should gain 25-25 pounds, 11 to 16 kilograms. C. You should gain 15-25 pounds, 7 to 11 kilograms. D. You should gain 15 pounds or less / equal to 7 kilograms. 4. Which nursing strategy is disruptive to the provision of nursing care for dying clients? A. Seeing a dichotomy between living and dying. B. Understanding that there is no right way to die. C. Learning to follow the client's lead. D. Maintaining one's emotional health. 5. Which of the following hormones is a direct target for the kidney? A. Progesterone and estrogen. B. Progesterone and aldosterone. C. Aldosterone and an antidiuretic, D. Pituitary and estrogen. 6. A 13-year-old child presented with a sore throat 20 days ago. He now presents with decreased urinary output, nausea, and hypertension. The most likely cause for renal impairment is an infection of A. Shigella, B. Streptococcus, C. Staphylococcus, D. Pneumococcus. 7. A normal walking gait sequence is A. Toe strike, midstance, heel strike, B. Midstance, toe strike, heel strike, C. Heel strike, toe strike, midstance, D. Heel strike, midstance, toe strike. 8. A 52-year-old male complains that he can no longer turn his head to back up his car. The normal body joint movement being affected is A. Rotation, B. Lateralization, C. Abduction, D. Flexion. 9. A client tore a rotator cuff playing tennis. The normal body joint movement being affected is A. Abduction, B. Adduction, C. Internal rotation, D. Inversion. 10. The most frequent post-operative complications of a TURP is A. Grape-colored urine, B. Ketchup-colored urine, C. Clear urine, D. Decreased urine output. 11. Which of these procedures removes pleural fluid for analysis? A. Bronchoscopy, B. Thoracentesis, C. Pulmonary function test, D. Lung biopsy. 12. Which of the following is an appropriate nursing intervention for a client with epistaxis? A. Apply heat to the nose, B. Have the client walk, C. Apply pressure to the nose, D. Have the client lie prone. 13. A Mexican client has an upper respiratory infection and wishes to take echinacea to aid healing. A. Tell the client that only antibiotics work, B. Let the client know a prescription is needed, C. Instruct the client that this is an inappropriate request, D. Notify the physician of the client's request. 14. Which of the following medications is commonly given to treat tuberculosis? A. Isoniazid, INH, B. Cisplatin, C. DDP, C. Carvedilol, Coreg, D. Floxuridine, FUDR. 15. Which potential complication should the nurse monitor for a client who has had a radical mastectomy? A. Lymphedema, B. Cerebral edema, C. Peripheral edema, D. Pedal edema.